Hello, everybody. We're going to be talking about amyotrophic lateral sclerosis, also known as ALS. My name is Komal Virk, and my partner's name is Jasper Cam. So first, we're going to do an introduction to what ALS is, as well as some of the mechanisms behind what causes ALS and the potential causes for it. Then we'll go into what a typical patient who has ALS would look like and what their progression and symptoms of their disease will be like. Then we'll go into some of the diagnostic criteria patients need to meet to be able to be officially diagnosed with ALS, as well as some diagnostic tests that they would have to go through. Next, we'll go into some of the treatment options that are available to patients who have been diagnosed with ALS, and then we'll end with a prognosis. So, also known as Lou Gehrig's disease, ALS is a neurodegenerative disease. It is characterized by the slow degeneration of alpha motor neurons in the ventral horn of the spinal cord and brainstem, which are the lower motor neurons, and of the neurons in the motor cortex, which are upper motor neurons. It's known as Lou Gehrig's disease in the United States mainly, because in the 1940s there was a famous baseball player. He was on the Yankees, and his name was Lou Gehrig, and that's kind of how everybody learned what ALS was. So right here we have a side-by-side comparison of what a normal nerve cell looks like and what one that has ALS would look like. So in a normal motor neuron, the neuron would transmit impulses from the spinal cord to the skeletal and smooth muscles. This innervation would lead to muscles to contract, and that results in a movement being generated. Now, with ALS, there is this gradual deterioration of the motor neuron. So those that are damaged will stop sending messages to the muscles. And as we can see between these two, on the left it looks normal, while on the right it's degenerated. Now, without these messages, the muscle is unable to contract, and this inability for contraction then further leads to a loss of functionality, because if the muscle is unable to contract, then it's at one point just not going to work anymore. There is still research being done on why ALS happens. The research being done is on both sporadic cases, which are cases where this happens spontaneously, and familial forms, meaning that it's the cause of it was genetic. Sporadic cases make up 90% of ALS cases, and the rest of the 10% is familial. The mechanisms involved in the degeneration of motor neurons can be varied depending on what type of ALS the patient has. However, it's been shown that a repeat sequence mutation on the C9orf72 gene has shown to be a significant risk factor for having ALS, as well as other neurodegenerative diseases. So now I'm going to just talk about two forms of familial ALS. These were the ones that were mentioned in the book, which is why we're going to talk about it. So the autosomal dominant form of familial ALS, it accounts for 20% of familial cases, and it's caused by mutations on the SOD1 gene, which is located on chromosome 21, and it encodes for superoxide dismutase. It's an enzyme that helps break down harmful oxygen molecules to prevent damage in the tissues. It is still unknown how this mutation causes this, but it is speculated to be because of a gain of function mutation, meaning that it's doing a lot more than it should. Autosomal recessive juvenile onset is a rare form of familial ALS. It's caused by mutations of diactine. Diactine binds to microtubules, and when there's mutations on the diactine, it results in defects in the development of spinal cord neurons and in the function of the neuromuscular junction. It's been observed that insufficient diactine can lead to higher failure rates of action potentials within the neuromuscular junction. For sporadic cases, some of the mechanisms that are being examined as a cause of ALS are reactive oxygen species, glutamate-mediated excitotoxicity, the induction of apoptotic pathways, pro-inflammatory interactions between neurons and microglia, mitochondrial dysfunction, and dysregulation of calcium homeostasis. And there are also other mechanisms as well. However, these were the ones that were more focused in the book. Now, these are all things that patients with ALS will experience. We're just going to be examining what happens, what kind of dysfunction is happening within the body, as well as what could potentially be the cause of ALS, sort of like the blueprint that's creating this chain reaction of events to occur. So reactive oxygen species are byproducts of aerobic metabolism. And when there is incomplete reduction of the oxygen during oxidative phosphorylation, it leads to superoxide radicals and hydrogen peroxide being produced. These further react with nitric oxide and a hydroxyl radical. The result of these products will then cause oxidative damage to DNA, proteins, membrane lipids, and mitochondria, which can cause mutations and disrupt the normal cellular activity. In patients with ALS, there was shown to be extensive oxidative stress. However, it is unknown if it is the cause or a consequence, meaning that researchers don't know if this is the reason why people get ALS, or because you have ALS, you will have oxidative stress. Induction of apoptotic pathways is another potential mechanism for ALS. Apoptosis is a regulated process necessary for normal development and maintaining homeostasis by inducing cell death. However, if this regulated process were to go out of control, it would lead to unregulated cell death. Researchers speculate that programmed cell death pathways are a mechanism in this disease, as there are anti-Fas receptor antibodies in patients with ALS, and the anti-Fas receptor is a byproduct of one of the apoptotic pathways. Another potential mechanism is a pro-inflammatory interaction between neurons and microglia. The pro-inflammatory response impairs neuron-to-neuron transmission, as well as cause a noradrenergic and cholinergic hypofunction, which leads to the deregulation of normal GL interaction and abnormal GL reaction, which then ultimately leads to neurodegeneration. This is that. Mitochondrial dysfunction can also be a factor. Patients with ALS have shown to have structurally altered and aggregated mitochondria. With the structure compromised, the mitochondria causes an increase in degeneration, as the mitochondria is unable to produce the ATP that neurons need to function. And since compromised mitochondria is found in all types of ALS, there is an implication that this is a core disease component. It's also been noted that with the mitochondrial dysfunction, the worse it gets, the more the disease will progress, which is why a lot of treatments for ALS try to target the mitochondrial dysfunction, as it can help greatly reduce the progression of the disease. There is a growing amount of evidence that has been pointing to glutamate-mediated excitotoxicity as the mechanism for ALS. Excessive stimulation of glutamate leads to excitotoxicity. Abnormal activation of glutamate receptors leads to neuronal death. With excitotoxicity, there is an influx of sodium and chlorine and destabilization of intracellular calcium homeostasis. This destabilization leads to a chain reaction of adverse biochemical reaction, which ultimately leads to neuronal degeneration. So like I said earlier, these are all things that patients with ALS will experience, what's sort of happening in their body. However, right now it's still unknown on which one is the root cause of why this is happening. Um, if you're confused about what I just talked about, or if it was unclear, this is on page 377 to 378 of the textbook. And now my partner is going to go ahead and give you the second half of our presentation.
This is Jasper, and I'll be presenting the second half of our presentation on ALS. At our clinic, a 45-year-old male from San Francisco has come in and told us that he's experiencing muscle weakness, cramps, and twitching in his right arm. Those are symptoms in the earlier stages of ALS, and if he indeed has ALS, his symptoms will progress toward complications that can be classified in the middle stages of ALS. In the middle stages of ALS, muscle weakness will spread toward other muscle groups in the body and will potentially become paralyzed. Difficulties with walking and swelling will also happen in this stage. By the late stage, the majority of voluntary muscles will become paralyzed. Feeding tubes and ventilators will also be needed in this stage. Unfortunately, patients in this stage will most likely die of respiratory failure, as this is the complication that is only seen in the late stages of ALS. Progressive muscle weakness, as mentioned before, is a symptom that arises in the first stages of ALS, and it can cause complications with completing everyday tasks. Abnormal muscle fatigue will be present. Tripping and dropping things will occur more frequently, and the patient's speech will be slurred. They'll also have difficulty swallowing. So in order for us to properly diagnose ALS, we'd have to go through different methods of diagnosis. So these methods would include blood and urine studies, EMG tests, nerve conduction velocity tests, MRIs, muscle and nerve function tests, and neurological exams. So while we're completing these methods of diagnosis, we'd have to follow certain criteria to make sure that our diagnosis is correct. These criteria would include lower motor neuron degeneration, upper motor neuron degeneration, and progression of symptoms. So ALS causes degeneration in all different systems of the body, and it can affect our neurological systems, digestive systems, and muscular systems. So it affects our neurological systems by taking away our brain's ability to perform and initiate movements. It affects our digestive systems by taking away the motor functions of our digestive tract and make it harder for us to digest our food. It takes away our muscular functions by causing the gradual degeneration of motor neurons and eventually causing our muscles to be no longer functioning. So there are currently no cures for ALS, but there are approved treatments that can prolong the lives of ALS patients or to help slow down the progression of symptoms. So the first approved treatment is Riluzole. It was first approved by the FDA in 1995. It's an orally swallowed pill and is shown to extend life by 2 to 3 months. The main purpose of Riluzole is to address glutamate-mediated excitotoxicity, as that is one of the functions or pathophysiological mechanisms of ALS that cause its effects that it does. And another approved treatment is Edaverum, and it was approved by the FDA fairly recently in 2017. It's administered through intravenous infusion, and it addresses oxidative stress occurring in cells. It does this by helping the body dispose of certain oxygen molecules called free radicals. And research has also shown that this treatment has slowed down the loss of physical function by 33%. And this picture right here is just showing how Riluzole works, as it's attacking the, or not attacking, it's targeting the presynaptic neuron, and it helps prevent the release of excess glutamate. So even though there are only 2 approved treatments, there are currently dozens of treatments that are being researched and approved. So these three are just the ones that I found to be the most interesting. And the first one is Neuron. And Neuron is a stem cell treatment, and it aims to slow down disease progression by replacing damaged cells with enhanced cells. The second one is HP Acthar gel, and that's an injection into the subcutaneous layers of the skin, and it contains ACTH. And ACTH stimulates cortisol production to help counteract the pathophysiological mechanisms in ALS. And the last potential treatment is Nurtec, and that's just a version of Riluzole for patients that are unable to swallow pills, since a common symptom of ALS patients is the inability to swallow. So this version of Riluzole is just a disintegrating tablet that you can put under your tongue. So physical therapy is also another form of treatment, but not as commonly used, since some clinicians have a mentality where patients would just lose their physical functions anyways, so there's no use for that at all. But research has actually shown that physical therapy helps patients retain muscle strength and improves their joint function as they're battling ALS. And physical therapists can make different intervention plans that depend on the stage of the ALS patient. So, like in the middle picture, where the PT is helping assist with resistance exercises, that can probably be done in the earlier stages of ALS, where the patient still has a good amount of strength in their legs, and they can do those exercises to help maintain muscle strength and just to prolong those effects of ALS that cause muscle degeneration. And then maybe in the middle stages of ALS, that's when you would have situations where it's like the pictures on the left and right, where they're starting to or trying to learn how to walk with assistance, or how to walk with proper maybe form based on how much muscle they've lost. And that'll just help them get around more or maintain their independence while they still can, instead of having to just rely on wheelchairs or just rely on those kind of means to get around right away. And depending on the cause of pain, physical therapy interventions can include things such as range of motion exercises, passive stretching, joint mobilizations, and just education about proper joint support and protection, since they are weaker. And physical therapy has shown to decrease the amount of falls that ALS patients take. And falling is one of the most common occurrences in different ALS clinics. And just falling can cause a bunch of different complications, like maybe like sprained joints or broken bones. So PTs or physical therapists can help prevent that. So ALS currently, as I said before, has no cure. So there are only treatments that help prolong or increase your chance of survival as the years go on. But it is a terminal disease. So this graph doesn't really show it, but on the left side of the x-axis, right next to the 0 on the y, it's supposed to be 2 years. So 2 years after your diagnosis, you'll have a 50% chance of surviving. But then as the years go on since your diagnosis, your chances of surviving will be really low. So by the 5-year mark, your chance of survival will be 25%. And by the 10-year mark, your chance of survival will be down to 10. And that, of course, progressively goes down until you reach whatever age you can. So even though this is kind of morbid, there's still hope that you can outlast the given chance of survival, since this is just like a survey or like a study where it just takes an account into a bunch of people. And there are still certain cases, or there was a certain case of someone surviving ALS for way past this chart, and that is Stephen Hawking. So Stephen Hawking, I'm pretty sure you guys know who he is. He was diagnosed with ALS in his early 20s, but he was able to live up to 76. So he basically went 50 years past whatever was on that chart. So for ALS patients, there is still hope that they can outlast it. And with all the treatments that are currently being researched, there could be treatments that can prolong life for ALS patients even more, and maybe take them past Stephen Hawking potentially. But even then, there's still Like, I don't think that the tunnel is all dark in a sense. There's still a chance. And Stephen Hawking, he was able to survive with ALS that long, and he was able to research a lot of things about like physics and all that kind of stuff. And he was able to have a lasting impact. And he's someone that many people know. So with ALS, it might seem like the end of the world, but I think that you can definitely try to outlast it. And that's it. That is our presentation. Thank you.